join me. I want to take a little pleasurable walk now, and I'm going to commence the changing of the name of the hospital in a symbolic and peaceful and nonviolent fashion.
And then let's get the bottom one more time. All right.
Okay, he's helping us here.
Well, he's helping himself, really, and, looking good. But, when they renamed it, or, they're really shameless about calling it the rebranding. We're rebranding to be Zuckerberg San Francisco General. And I just think this is San Francisco General. This is the community and the county and city hospital. It should not be named after someone who sort of gave less than what an ICU nurse would make in a 12-hour shift proportionately, when he was like raking in the dough hand over fist. And anyhow, it just stuck in my craw then, and now after all the stuff about the elections and Facebook selling all our crap to Cambridge Analytica, it's all the more reason to get him off the front door here. And it'll look good when San Francisco General is right up prominent and it doesn't say Zuckerberg. He gave $75 million over 30 years.
Wasn't that a tax deduction?
It's that too, and it's sort of like, moving his money around, and also his pocket. And what did it end up being? Little signs, rebranding signs all over town. And I'm sick of it. And, there's enough how do you get, everybody I talk to in here agrees, but it's hard to really mobilize people because they're so overwhelmed with just trying to keep it together on every other.
Is there a shortage of staffing here?
Oh, just a little bit, yeah. My department is very understaffed. All of it, and it goes on, Steve. I'm telling you.
He says he's trying to help out. He's trying to help all of us with his donations.
Well, and he's very sorry, too. He's really, really sorry. I call everybody's attention to Samantha Bee's piece on Facebook and his recent testimony. You can YouTube it. And she really kind of puts some, doesn't pull any punches.
So are you saying that they should change all the names here? They should rebrand it to just General Hospital?
I would, there's
that would cost a lot.
Fargo Plaza, there's Kaiser Permanente, Hoobie-Doo. Everybody's got their name somewhere here, so, I don't want
That's another clean company, Wells Fargo, huh?
Well, yeah, the king of foreclosure. I'm trying to...
2 million fake accounts, illegal fake accounts.
It's outrageous on every front. But, I wouldn't mind, I don't mind him having a little piece of the corporate pie here, but it's still a public hospital, and let's tone it down and put San Francisco up front, not Zuckerberg. That's my feeling.
When I say happy, you say...
International Nurses Day!
All right. I would now like to introduce the Executive Director of SEIU's California Nurse Alliance, our professional organization that represents us and does a great deal to try to make our workplaces safe and to be able to stand up for our patients and patients' rights. Here is Kathy Hughes, everybody.
And like Sasha said, the Executive Director of SEIU Nurse Alliance in California, we represent about 35,000 registered nurses in California. I'm proud and honored to be here today. I want to just let everyone know nurses pride themselves on caring for all of their patients and clients with the same amount of professionalism and compassion and care, regardless of whether they're a billionaire CEO or whether they're someone who's indigent and living on the streets. We don't need the government to tell us that it's okay to discriminate against those that we care for, because that's not who we are and that's not what healthcare workers are about. So we reject that pridefully, because that's not what we do, and that is certainly not what San Francisco General Hospital is about. They are a public sector safety net hospital. They've been caring for the people in this community for decades. They do it equally well, again, whether you're a billionaire or not. And I think it's important to recognize and respect the history and the legacy that the General has in this community and the people that they serve. They've been here in the 80s. We have Louisa Blue here with SEIU, who worked here as a registered nurse in the 80s during the AIDS epidemic. when all of these beautiful young gay men were dying and no one knew why, the nurses and healthcare workers in this hospital never stopped caring for them, never stopped giving them compassion and love and the professional health care that they deserved. And in that vein, they addressed safety needles legislation and bloodborne pathogens. And they started that on a local level. Then the nurses in this hospital took it to the state, and then they took it nationally. Nurses like Lorraine Thibault, who testified at Washington, D.C. around the importance of safety needle legislation. They lead the way. They teach us everywhere in the country, and especially in the state of California, how you care for patients with respect and compassion and professionalism. And I think it's important that we recognize that right now. And so I don't think that changing the name is an appropriate, it's pretty tone deaf. I mean, it really tries to erase in some ways, again, that history and legacy. And so I'm proud to stand here today and humbled to stand here today to say, because of the work the nurses have done here, I have never been stuck by a dirty needle in my 20 plus years of being an RN. And it's because of their work and their sacrifice that there are nurses and other people in the community alive today because of the work that you guys all led. And I can't even tell you the heartfelt gratitude that we have for that.
The one for right here, and we're going to be asking them for action on this petition here. And thanks to the miracle of the interwebs, we don't have to have 7,500 pieces of paper. But here is the, would you like to read it, or should I?
No, go ahead.
Okay.
I don't have my glasses on.
Demand the right to health care without discrimination. Nurses in the communities we serve demand the right to health care without discrimination. This is a central part of our Nurse Practice Acts, state by state, and we call on the U.S. Congress to pass legislation to prevent the Health and Human Services Department from implementing policies designed to give health workers the unprofessional right to discriminate. The newly created Conscience and Religious Freedom Division, with major air quotes there, of Health and Human Services is inviting healthcare workers to deny care for certain patients. For example, a nurse might cite a religious objection to caring for a transgender person or refuse to include the spouse of a gay or lesbian person while planning care. This is wrong because healthcare workers, unions, and management all agree that all patients deserve quality care free from discrimination. Millions of healthcare workers of every religion and no religion work together every day without incident. Religious and professional codes alike forbid discrimination. And finally, hate has no place in our healthcare system. We demand that Congress direct the Office of Civil Rights of Health and Human Services to disband the Conscience and Religious Freedom Division and instead work to eliminate bias in healthcare. Right. So now I need to tell you about how this wraps together, because I don't believe that Mark Zuckerberg or Priscilla Chan, his partner, that they would willfully like there to be discrimination in healthcare. I'm not saying that they're homophobic or transphobic. Unfortunately, they have done things by accident that are very damaging, particularly to LGBTQ people. And one of those things that has happened, and happened over the past few years while they were deciding to change the name of the hospital, was that they decided to have a real names policy that made it so that performers, people that are trying to get away from domestic violence situations, transgender people who have their authentic name assigned to them, were overnight, without any notice, had their names changed to their legal names because they thought that that would be helpful. That endangered people. People lost their jobs because of that. There were drag queens that had the difficulty of then they weren't able to do their work anymore because their name wasn't available. They couldn't find their name if you wanted to hire somebody. There were sex workers as well who were made vulnerable because we had SEIU 10-1 represented the lusty lady and the dancers there, and for those dancers that they needed to get a new job after the place closed, And how is it going to be if they're trying to get a job and then they have that name, their legal name is out there? It's a dangerous thing that happened. And there was a big effort of drag queens marched on Facebook to do something about that. So that's one issue of vulnerability that's very specific about that people aren't paying attention to and we need to pay attention to. The other problem is that related to that is that people really need to know that before Cambridge Analytica, Facebook had done their own unethical research on almost 700,000 people. And I have a PhD in nursing, and research ethics are something that are very important to me. And what they did with this was not, when people hear about the research thing, people just think like, well, you signed up for Facebook, so you got to expect that, right? But this wasn't just looking to see what people were, what they were choosing to buy. This was something so
Heinous?
it's heinous. Did you say anus?
Heinous.
What it is so heinous, and I need to describe it to you so you know. They wanted to see, this is back in 2012, if they could promote the spread of emotional contagion, like a disease. So they picked people, and then they didn't give them fake news at the time. They gave them from their friends. It may have been some of us. They gave them their friends bad news or their good news. If you were lucky, you got the good news with the kittens and pictures of meals. If you were unlucky, you had people showing beheadings or something that they were angry about. That's not all they did, though. They went back to all of those individuals then, and they looked to see what they posted afterwards. If they had the negative news, then they would be marked down as that it was successful. It was a successful effort because they posted, I'm miserable. Everybody seems miserable in the world. I'm going to end it all. Is a possibility. They published this evil, unethical thing without any regard for what happened to people that, as a result of that, to almost 700,000 people, and they did not seek the approval of any ethical review people. They went to Cornell University and they found a researcher there who apparently was not paying attention during the ethics classes, and the researcher said, oh, if it doesn't have names on it, it's okay for me to look at this. So they looked at that, they wrote up that research, they took it to the National Academy of Sciences, and the National Academy of Sciences published this Dreck. I'm going to just use the good Jewish word, Dreck, for this, and they then paved the way then for Facebook to do other things. So the people that have been killed in Sri Lanka because of the emotional contagion that Facebook proved that they could accomplish, there's blood on the hands of Facebook and the researchers who did this. That's something that's very important to me, and then when I brought that up to people, it's kind of a wonky thing, but unfortunately, Facebook at the time said, we're sorry that happened, we didn't mean any harm by that. And then when I brought this up after the Cambridge Analytica thing, people said, I'm concerned that Facebook has been trying to access us right here and trying to manipulate our emotions and to manipulate the politics of San Francisco. It seems like a plausible hypothesis. I don't have proof of that, but I was concerned enough about it to notify the privacy office here. And then it was just announced while Mark Zuckerberg was testifying to Congress. It was just discovered by CNBC, and it was reported that Facebook hired in 2018 a physician to try to get, so on this flyer here, the title of the April 5th story is, Facebook sent a doctor on a secret mission to ask hospitals to share patient data. So I have a question for the healthcare professionals here. If I say, hey, will you give me a list of all your patients?
No. Hell no.
Okay. Okay, how about if we take the names off it? You can just give me a list of just their data, but not their names? No. Okay, that's not that hard, right? Because we all get trained about privacy protections, and it's a big deal. And there's people that have been disciplined here for taking pictures of themselves dressing up or something on the job, that they get in trouble for that if that goes onto Facebook. And meanwhile, Facebook has been rewarded with getting their founder's name on the hospital here. So that is not okay, and we need to not send a message to people that if you give $75 million, you can do whatever you want, because that is what they're essentially saying, is that you can do whatever you want as long as you give some money. And I also just want to make it really clear that this is not really not a partisan issue. I've heard from a colleague who is a Republican when I posted about the plans to do this, and I said that our union really should do something about it. She agreed, and she agreed in only 3 words once she saw the picture. Get a ladder.
My name is Guy. I work at Ward 86 here at the hospital.
What's Ward 86?
It's the HIV/AIDS ward, the very first HIV/AIDS ward in the world. It's the outpatient clinic. I work for UCSF, but I work at the General. My heart is at the General. I may be employed by UCSF, but my heart is at the General. And it will always be the General to me. So, what do we do in medicine and in nursing? First, we diagnose what's going on. I have some markers with me. I brought a lot of stuff. You never know what may be needed.
That's why God hates bags.
Purses, I should have, right? So, I came up with a differential diagnosis for this problem. So, it could be Zuckerware. It could also be Zucker, but that is maybe too much. It could be Cyberberg. It could be malware. It could, of course, one of the first things that comes to mind is that it is face slap book. What else did I thought? Oh yeah, there is, of course, Zucker breach. This can't be an exhaustive list of all the differential diagnoses, but we want to kind of narrow it down to something that we can work with. Spyware. Did I leave anybody out? Zucker breach, Zuckerware. Zuckerware. All right. Anybody else have any other possibilities?
No, I think you need to fix him.
PTSD? PZSD, I like it.
Excellent.
PZSD. Sorry. And then, of course, there is a healthy component of affluenza in here as well.
Affluenza, yes. Affluenza for the win.
We need a vaccine.
Yes.
So do you have any plans for this, or just the
Well,
diagnosis?
I wanted to discuss that because we have a bunch of fantastic people together here. We need to come up with a plan. We have our prescription pad with us, and I had a couple of ideas, but your input is very much needed. So what I came up with so far, thinking about this stewing at home behind my computer, is the first step in the treatment would be to discontinue Zuckerberg. Stop that.
My name is Mary McGee. I'm a registered nurse who's worked in the Department of Public Health for 31 years, and I simply want to say this. It's my understanding that San Francisco General was started close to 150 years ago. It has been supported by the taxpayers for over 100 years. There have been people who have worked here as volunteers, helping to bridge the gaps around staffing and sitting with people. There have been people who have worked long beyond their hours, people who have gotten permanently injured on the job. There is a community that supports this hospital repeatedly, and we know that from the most recent bond measure to rebuild San Francisco General, which Ed said cost
just under $1 billion.
just under $1 billion. This is one of the largest bond measures in the history of the United States, and San Francisco voters resoundingly voted for it because they know this is their community hospital. Even if they never set foot here, if they are in a terrible accident, they know that they will come here, and there's extraordinary life-saving expertise. As more and more people are losing their jobs and losing their homes because of the gentrification in San Francisco, they're going on Medi-Cal, they're needing to access services, and they're getting to know their community hospital. The other thing I just wanted to say was what's so shocking about Facebook sending a physician out, and I believe it was to Stanford Medical School and the American College of Cardiology, to float this idea about syncing data between people's medical files, medical information, and their Facebook information, even if anonymized. Their goal was to, their stated goal was to be able to pick up when people are feeling social isolation. For the love of God, we can figure that out by spending time with our patients.
That's right.
So it's about staffing, and it is about being able to really connect with our patients and being given the time to do that. It's about primary care providers being given more than 15 or 20 minutes to be able to address all of the issues that a patient might bring to them.
Right.
There is absolutely no need for that kind of risking people's private information, and I have to be honest with you, I'm appalled that Stanford or the American College of Cardiology even agreed to meet about this issue.
That's right.
So I just want to say in closing, and I'm sorry this was long, we've got almost 150 years of history of this extraordinary community hospital that has been there on the front lines when very frightening things happen, like an AIDS epidemic or a SARS epidemic. And then other things, like figuring out that there are grandparents out there that are raising their children and the kind of stressors that are there, and coming up with support groups and cancer, theater support groups, and all these innovative programs that the wonderful people who work here come up with, and then work with our patients and patients who are on patient advisory committees, and really making this a joint interactive effort between patients and staff. I appreciate that Zuckerberg put the finishing touches on this building, but it is absolutely an affront to our community.
That's right.
That the whole hospital was named for him. And I'm not even advocating that it be named for someone else. I just think it should be San Francisco General Hospital or San Francisco General People's Hospital.
Right.
Right.
I'm Meg Brizzolera. I work on the jail unit, psychiatry.
What's happening here?
Well, it has to do with Mark Zuckerberg's name being on the marquee. He gave us $79 million, and we're grateful for it. I don't want to give the wrong impression. I mean, we're thankful for the money, but the taxpayers gave a whole lot more than that. And given the fact that he's compromised privacy of Facebook users, I think people need to think twice about their privacy, given their health data, and having this guy's name on the public hospital.
And you say there's a shortage here. I mean, it seems like he can give $79 million he can provide for staffing. Well, how is it staffing here?
Well, they tried to, nursing in general, private sector, public sector, tries to make nurses do as much as possible for as little as possible. It's true everywhere, and it's no less true here. Thank God we have a union that protects us to some extent, but in my department, our MOU is violated all the time with staffing language. They've reduced the Department of Mental Health here, the psychiatric department, from 4 units down to 1 acute unit, one acute unit to treat the entire city of San Francisco.
There's so many homeless, mentally ill people in the streets here in San Francisco. It's like dystopian. Here's all the billionaires.
Them on the way to the symphony, yes.
What does it feel like? You've got all these billionaires here, and yet people are dying in the streets, and you don't have enough staff.
I think it's sick. I think it's horrible. I mean, it's a shame. It's a blight on us as a country, and a city. It's a blight, and I think it's horrible.
Does Mark Zuckerberg know about this?
I'm sure he does. How could he not? I mean,
He's too busy fixing all the data leaks.
yeah, he's too busy looking at our personal information.
Does that bother you?
Yeah, it bothers me a lot, yes, especially since he won't even tell us what hotel he stayed in the night before. No, that bothers him a lot, yeah. So, I mean, it's an issue. I mean, nurses have been disciplined for having their significant others come to pick them up from work and walking onto the unit and seeing a chalkboard with patients' names on it. Oh, that's a HIPAA violation, a privacy violation. You know, and been suspended. I know of one nurse that was suspended for that. And yet, Mark Zuckerberg has access to every patient that walks in the door.
How does he do that?
I don't know. Technically, I don't know how he does it.
He has access to the patients here?
Well, I don't know about him personally, but
his company?
Good. His company does.
And how is that?
Well,
Do they have Facebook pages?
well, they probably do. But I mean, a lot of people have Facebook pages, and he's already mined their data with Cambridge Analytica for voting purposes. But, you know, Facebook has done some really questionable things, like manipulating what you see first to see how you react to negative posts versus positive posts. But what's even worse is that Facebook has mined personal health data, and I don't know as much about this as Sasha does, but I know that it has happened and is happening. I don't know why they're doing it. I don't know what they hope to get out of it.
They say they want to help us out.
Oh, I believe that. Yeah, and there's an Easter bunny too. So,
So do you think that is one of the things about his donation to General Hospital, that there's a possibility of mining information here at the hospital?
There's a possibility of it. I don't know what his motives would be. I mean, why would he want this information? I don't know. But of course, he's already doing it. So he has some reason. I'm just not savvy enough to know what it would be.
And the healthcare situation, I mean, you've got 40 billionaires in San Francisco, 140 billionaires in California, and yet a $9 billion or $9 billion budget surplus, and yet people are being forced out. They're on the streets. I mean, what is going on?
Well, you know what's going on. It's inequality altogether. It's getting worse. The haves and the have-nots. I mean, the line is getting further and further apart. And, you know, as long as we have the kind of leadership we have, it's capitalism. It's what capitalism does, and it only gets worse. It doesn't get better. And we're seeing the collapse of it. That's my opinion anyway. I mean, other people might not agree, but, you know.
How long have you worked at the hospital?
30-some years, since 1987.
And how has it changed?
Oh, it's changed tremendously. Huge cutbacks. I mean, like I think I've said before, we went from 4 acute inpatient units in a psychiatric emergency room to 1 acute unit, 1 for the whole city.
And this was the massive healthcare crisis here. I mean, mentally ill on the street.
Exactly. San Francisco used to be a model city for mental health care, a model city. Now it's a shadow of its former self, and it's pathetic.
But this is Claire. Claire is a friend of mine's daughter, and when I show you that picture, you can see Claire's holding up a piece of paper there. And when I show you something with a friend's daughter, and I'm at the hospital, what do you think about that? Does that make you a little bit nervous? I hope it does. Yeah, because we're concerned about privacy. So I spoke with my friend to ask for her permission to show this picture of Claire. So I'm wanting to. I find that with nurses, including myself and nurses when I've been an instructor of nursing as well, like to have stories about real live human beings. And I think that that's important, and that's one of the reasons why I look the way I do, is because I'm here for the people who are invisible, who are otherwise invisible but very important people. So Claire died recently. Claire was not murdered for being the trans girl that she was. But Claire, in this picture, what is captured in this picture is that she was not always a happy child before transition. She had a very difficult time growing up in a mostly white neighborhood, being born in Korea and looking different for being Korean, and also behaving differently because she was on the autism spectrum as well. Claire got sick from cancer and went to a community hospital on the East Coast, and my friend, who's also a nurse, was not happy with how they treated her, and they were disrespectful to her gender, and she ended her life in another hospital. And when she came to that hospital, the nurses were like, what's going on? How are we supposed to handle this? They hadn't had a transgender patient before. And after a time there with my friend Andrea's support, the nurses learned, and they said, she's Claire. We're taking care of Claire. That's who she is. And in this picture that I didn't see until after she had died, in this picture, she is holding up the certificate that made her name Claire legal. It was so important. This wasn't a game. And she never looked so happy. She is beaming with pride that she is being recognized for who she was. And when she died, Andrea said that she would have been happy because they put on her death certificate her gender, that she was a girl. That is what is at risk. That's what I want to tell people. The Affordable Care Act didn't do a huge amount to make care more affordable, and now they're trying to make it worse again. But what they're also trying to do, because Obama made the mistake of trying to be a president while black, let's make that clear, they're trying to chip away at everything. And one of those things, the reason why those nurses were better at that second hospital, is because anti-discrimination was part of the Affordable Care Act. You were not allowed to discriminate against people or to mock them or to treat them differently or poorly because they were transgender. And that is what is trying to be taken away also right now by Health and Human Services. And it's unspeakably evil, and that's what her experience could have been a lot worse, and it would be up to the healthcare workers could say, my religion doesn't believe in transgender people, so I'm not going to take care of that. So I want to ask you, would you help Claire?
Yes!
All right. Happy
International Nurses Day!
This is Florence Nightingale's birthday today, and Florence Nightingale, just to let you know, the lady with the lamp spent the other half of her career advocating for another very lost cause like ours, and that was for the freedom of India from the British Empire. She took that, and she died 37 years before India was finally free, and I'll bet you that all of her friends in government were not happy about her making noise about that. So people may not be happy with me, but I'm going with the flow. Let's go with it. About the commie and the doctor.
She was evolved.
Yes.